Welcome, everyone. Answers for Care is here in full effect, and I'm so excited to have you on this webinar. This webinar is on in-home care, why you need it, when to act, and who can help. So for those who don't know, Answers for Care is the village of senior care solutions for all of your care needs. So when we're talking about in-home care, which we'll talk about in depth, we're telling you and helping you determine in-home care options, which can be emotional and stressful. And some of these you might not even think of as in-home care options, but at Answers for Care, we make things easier. So let's just briefly talk about Answers for Care or show you Answers for Care. Hopefully it will go through or not. What we're going to do is go into, let's stop my share for a second. Okay, so Answers for Care is the village of senior care solutions, and there's many ways to get to this. So we have services listed here. Last month, if you missed it, we have the replay. We talked about legal and financial experts, everything from accounting to trust and estates attorneys and everything in between. Of all of those services that can help you, your family, a loved one to get the services that you need. When you're looking for any of these services, we broke them down into 4 categories. So there's legal and financial, then there is in-home, which we'll be talking about today. Healthcare, these are generally for non-physicians, clinicians, but they do go into your home. So there could be therapists and that kind of thing. So run the gamut of that. And then we have a section called navigation and care and support, which includes people like me, who is a patient advocate, as well as geriatric care managers and end-of-life doulas. So speaking of that, I don't think I introduced myself at all. My name is Nicole Christensen. I am a board certified patient advocate and the proud founder of Answers for Care. Right now, again, we find pre-screened Long Island elder care focused professionals near you. So right now we serve Nassau and Suffolk counties, soon to expand, but we're really excited. So how do you find somebody? So you can go through many different ways. If you know a person's name, so say, or a name of a company. So if I said, oh, you know what, I'm really trying to find some assisted living placement or independent care, I am going to, I know about Adam, I think his name was. Let's see what we got. There we go. We see Senior Care Authority, Long Island, and then you can view their listing, and that's Adam Flatow, one of our professionals here, vetted professionals on Answers for Care, and you can see all about them. Now, one thing I want to point out is this here, it says Answered Care, and it's a check mark. That means they're verified, they're vetted. All of our pros are indeed vetted. So if you see that sign, that logo, that means that they have gone through a criminal background check, their company has gone through a background check, and they are suitable for our village of senior care professionals. It also means when they are a vetted professional on Answers for Care that their professional rating and their social media kinds of ratings are at least 3 stars. To be honest, right now, everybody is 4 stars and above, but that we want to bring you the best of care. So that's what you'll see. Also, in addition to that, you will also notice that for the services you get, if applicable, if there is a charge for the services, which mostly times they are, but not always, there'll be a 5% discount on one care professional, one service of the care professional. So, for example, if we go to in-home care and we did something like a move manager, then we do have a verified, they're a new pro, so they're not even listed appropriately yet. They're working on that right now. But there might be a 5% discount on one service that they offer. Hold on, let me just let some more folks in that are coming in. So that's what you get from Answers for Care. Additionally, as I mentioned before, if we can just mute ourselves, that would be great. Thank you. So when you go to them, when you're finding your service provider, and let's say you go to Oasis and you find who you're looking for, you can enter your name and information and they will reply within 24 hours. So gone are the days of hoping that somebody calls you back or that you had the right number or it's a real great professional. They will contact you within 24 hours if you go through Answers for Care. So again, it's at your fingertips, all of these wonderful services and vetted professionals. So going back to what we're talking about today, which is in-home care. And hopefully my screen changed there. Okay, we're just gonna let somebody else in here. Okay, so now we talked a little bit about how Answers for Care works, and we have great professionals that are vetted and here for you and the top in their field on Long Island. So what's included in our version of in-home care? So it runs the gamut, like I showed you, but here are some of the professionals we'll be talking about or services we'll be speaking about. So home health aid agencies, home and safety modification, personal transportation, organization and decluttering, technology support, meal delivery, move managers. So that comes through many different things. So let's go with home care agencies. I feel like everybody thinks they know what they are, and it's probably the most common. But when would we be looking for a home care agency in reality? Well, we're going to be looking for them when we have an impending discharge from a hospital or skilled nursing, and or just more care needs become apparent. Let me just get a heads up. Can everybody see my screen that says home care agencies?
Yes.
Okay, perfect. Thank you.
Yes, Nicole.
Thank you, thank you, thank you. So, why would we use it? Common reasons for a home care agency, or even just to find out, because in all of these things that Answers for Care provides, all of the different services, it's wonderful to know about it before you need it, right? Crisis is a horrible time to be making decisions. Now, if that does happen, you can rest assured that any of the vetted pros on Answers for Care, they're going to be solid quality providers. But still, it's important to know so that you don't have to guess. You know where to go when you do need it. So some of the common reasons are doctors may advise that there may be more care need in the home, right? Or you notice, or a loved one notices that someone needs more help with everyday and or personal care than they can provide. So if somebody's helping you out, you have a loved one that's helping you, all of a sudden it's becoming a little bit more than they bargained for, or more than they can provide because they have many other things going on as well. Or they don't have the physical, emotional, or mental capacity to help with all of those things, which is totally natural and not something to feel guilty about. We only have what we have. So, or someone visited and noticed that the home is not kept up like it once was. We see that a lot around different holidays, but the summertime too, when we're going to visit loved ones that may be older adults, and then we notice, wait, this is not how he or she usually kept her house or his house. So maybe there's something going on. Maybe they just need a little bit more care in their home. Or there's a notice of pills that aren't taken or food not eaten. that's also an indication that there might be some more care needed in the home. I don't know if we have any of our pros that are home care agencies on, but if you'd like to add to that, please feel free. The next is assisted living and senior placement. So some people don't know what this is, right? So when do we really think about this? When you're family or an individual or couple as young as 55, because as what I know, I'll speak personally, as the older I get, the older I decide a senior is, right? But the truth is there are senior living um, communities that are 55 and over, so they can help you with that, or looking at options of what to call home in this next chapter of life, right? So why would we see that, or why do we see our professionals seeing it? Older adults, they're living in their same home that they've lived in for decades and decades and may have raised their children there, but the quality of life is now limited due to the isolation they feel. They're not able to do all the things. Maybe people have moved away that they were friends and neighbors with. Or adult children or family have been caring for older adults in the home, but can't provide that 24/7 care as needed. Family are trying to provide care and a crisis comes and they're looking for options. So those are some common things that we hear. And you might ask as a patient advocate, why do I know these things? Um, because as a board certified patient advocate myself, I know it takes a village to provide the best care. So I did a little bit of research, but it's really these pros on Answers for Care that gave me these instances, or these most common instances. And I believe Maura is here. If you'd like to add to that, please do. See.
I'm here. Sorry
Okay.
about that. I could
I
not
had a
shut off
funny
my
feeling you were going to come in.
yeah,
So,
I'm sorry. I could not shut off my turn on my microphone. So I think the biggest thing that I see as a placement specialist, my name is Maura Ryan. I am the owner of All Care Senior Advisors, and I advise families in this exact thing when they're looking into assisted living, independent living, or memory care. By the time they come to me, they are usually in crisis mode. So, I feel like if people were to start looking early and educate themselves, it wouldn't be a shock to their system, or it wouldn't be something that's an overwhelming task that's happening. If you educate yourself and kind of keep that information in your back pocket, you already know, you've already been out there, you know what these communities are, you understand the difference between the licenses, and you know what the costs are and what's included in those costs, and is medication management a separate charge. You have all of that information, and you're not just purely you know going forward out of fear, out of being overwhelmed and not knowing even where to start. I hear that all the time. So those are the things that I hear. And I think that education for yourself, Nicole, you said it perfectly, where I'm 53, so 55 and over to me is not a senior, but for us to start educating and look at where we feel maybe our next steps will be down the road, you're already ahead of the game. And to not have to leave that on a family to make those decisions for you is also a really, really big responsibility to take off of your family members, because adult children have guilt. They have guilt that mom's not going to stay at home, or that mom is going to go into a facility, or dad, or whoever it is. And I think the other thing too is to really look at these communities, like Nicole, you mentioned. These are social model. They have a social aspect to them. Being in the home that you've been in for 60 years is fantastic. Those memories do not go away, but that's a brick and mortar building where you tend to become more isolated and less engaged. And that's when we start to see, cognitive decline happen. So it's healthy to be in a community, where you have a circle of friends and you're doing things and you're engaging. And, the people saying, if you don't use it, you lose it for your memory is so true. So, for the assisted livings, especially, you're always doing new activities and learning things and going on trips and really enjoying your life. And that's what it should be, is enjoying the quality of life that you have and not sitting in your home. I hope that was okay, Nicole.
No, that's great. That's great. Thank you. Absolutely. Thank you, Mark.
Thank you. You're welcome.
So, um, move managers. What is that? That's not a necessary term that we always think about. So, when do we look at a move manager? When we're looking to downsize or upsize or relocate, or as Maura mentioned, and we just spoke about, moving into a different space, a space like an assisted living. So, why would we use a move manager? And because moving is hard and you want ease in this transition. And moving does not get easier as you get older. Many times people equate a move as a death, right? And because even if it's a great thing, you're super excited about it, it's hard. The emotions are there, like Maura said. You may have raised a family there. So it's a hard transition, even though all transitions, right? The transition part is the hardest part, not getting to the other side. So the move, going to the place that you're going, may be wonderful for you, but that transition is difficult, and it's sometimes wonderful to have help with it. Or you want to make sure that your items will fit in your new home. That's just logistics, right? If you're downsizing, or you're going to a senior community or assisted living or memory care, and you had a house that was 2,400 square feet or what have you, not all of that is going to fit in the same space, but you want to keep the things that you really love. And so you need help trying to figure that out, or it gets really overwhelming for families as well. And family help is sometimes complicated, right? People that love you so very much don't always have the insight or knowledge or patience or understanding to be able to assist you in that move. So you want assistance selecting the precious items to bring with you, those to discard, and ones to give away or sell. And our move managers on Answers for Care, those pros, those vetted pros, they know what they're doing. They specialize in moving older adults. They ask the questions, they take the time, they're with you through it all. So that's where you can find a vetted professional that you'll love on Answers for Care. Okay, safety home modification and equipment. When do we need that? When living at home is the answer, that's what you want to do, but you need modifications to make it safe. Okay, so, and why? Stairs sometimes are a challenge, and maybe ramps or chairlifts are the answer. Bathroom accessibility is a struggle, and there are options to make it safer. So, if your choice, and again, Answers for Care is here to put you on the path to your options so that you get the best service and the best professionals. So, whatever your choice is, we want to make it safe for you. Or independence is important, and you need to make it safe so that you can keep that independence. Oftentimes, when I am meeting with a family as a patient advocate, I will go into their home or we'll do a virtual of their home, and there are easy fixes to make it safe, to help avoid a hospitalization that may lead to less choices, or the choice of staying at home being eliminated. So we really want to be looking at this often, and to see and talk to our doctors about it as well. This is what's going on in my home, because they're not in your home, generally speaking, if the doctor doesn't do home visits. So you can say, hey, this is what's going on. Is there any assistance? And they might not know the answers, but hopefully they'll have Answers for Care, and you can go on there and ask some of our professionals there that do that safety home modification and equipment, and ask them. Oftentimes they do a free consultation, come into your house and see what it is you need. So you can find those professionals on everybody now, Answers for Care. Okay, the next is a certified home health agency, commonly known in our world of patient advocacy and senior care solutions as a CHA, which is just an acronym. So this is different from a home care agency, and I know it's confusing because the words are very similar. So we talked about home care agency in the beginning. Certified home health agency is oftentimes when we think about them, it's post-surgical care, post-hospitalization, or a skilled nursing facility, aka a rehabilitation, or when a doctor prescribes it. So this is what we really need, that often is covered by Medicare. And we're in New York, obviously, we're covering Long Island. So the New York State Department of Health certifies them. And again, they're often covered by Medicare and assessed by their nurse. So the child nurse will come, and you could potentially receive the following services through a CHA: wound care, physical therapy, occupational therapy, speech therapies, as well as limited home care aids, right? So you can get all of those things and potentially have it covered by Medicare. So these are things that you can look for if somebody is in a hospital. You definitely want to be having this conversation before discharge. Okay, so technology support. These are things that maybe we don't think about, but that are really crucial for our lives. Just this webinar, right? I'm asking, can you see my screen? Because when technology doesn't work, it really can be a pain in at the least, and really cause harm at its worst. So, when do you think about this? When you want to access computers, electronic devices, and apps more easily. And that's for all of us, honestly. It has no age limit. And why? You want to know how to better use your new smart device, like a laptop, smartphone, or tablet, um, or to use better a device you already have, or you want to connect with loved ones easily. It's so wonderful that we have these kinds of capabilities now that 20 years ago we didn't, or they didn't work as well, like this Zoom that we're on right now. But if your parent or grandparent or aunt or uncle or close friend want to get in touch with you, but you don't know how to utilize those, you have the devices but don't know how to utilize it, it kind of cuts you off. So getting that support is very helpful. And then there's the other thing, regarding logistics of online banking, electronic filing, safeguarding important paperwork, or even being able to connect to your doctor if you're having a offsite visit or an online visit. And just learn how to use devices for fun as well as your own safety. So it's quality of life. So I believe Wendy's here. Did you want to add anything to that? Let's see if I can see her. Oh, I guess she's not here. So, which is okay, but she is on our Answers for Care, and her name of her organization, I believe, is Tech Time, and they do great work as well. Okay, I did something wrong here. My screen is no longer advancing. Hold on. See, I need technology help, and she's not here. Just kidding. Let me just stop my share for a second. And then we can go on to the others. Sorry about that, everybody. All right, let's try this again. Okay. So what else do we have? Home delivered meals. And when do we need that? When getting your right to nutrition becomes difficult. So why would that happen? You have limited time or capability to make your own meals. You have diet constrictions, make it challenging to make the right meals, or the loved one that usually prepares the meals is unable to. This is a huge thing because health and nutrition are so closely correlated. And if you have diagnoses that make it very important to your health to have the right kind of meals, this is not something you want to avoid. You want to make sure you're getting the right nutrition for yourself. So, and there are agencies that actually take insurance, like Medicare or Medicaid, to have those meals delivered. And then there's some that don't. But you will find some of those agencies. They're not vetted pros yet. I've tasted some of their food. It's really quite good. I would never ask a pro or even present it if I didn't believe in their offerings. But just to know it's out there, it is on Answers for Care if you want to check it out. Now, organization and declutter. I don't know who doesn't need more organization in their life. I'm sure there's somebody, but it's certainly not me. Um, so, organization and decluttering can really make a huge difference in anybody's life, but especially when you're an older adult. So, when do we look to this? When we're finding bills or important papers are getting difficult. We're not able to find those things. And as we all know, whenever we've had to find something for ourselves, no matter what age, you have to have the paperwork, even though we're supposed to be completely digital. We're not really there yet. And even if it's not on paper, if it is digitally, you need to access it. That goes back to our technology. But um, clutter is inhibiting mobility. That happens for folks. They can't get around their clutter, or potentially they have a walker now. They used to be able to not utilize a walker or potentially just utilize a cane. Now they have a walker and they're recognizing now that there is clutter and less organization. Um, or potentially organization will allow you to breathe easier and give peace of mind. That's so important. So that would be another reason to utilize an organization specialist. And again, why clutter and disorganization is getting in the way of safety and or quality of life. We don't want this. It doesn't get easier again as we get older. And sometimes a loved one is doing their best, but it's really hard. That's when you might want to look into a professional, and you can find them on Answers for Care. So those are our in-home care need professionals that we have on Answers for Care. We're continuing to grow, so feel free to reach out to us if there are other professionals or other things that you think would be great to add in our in-home care. I also wanted to let you know another thing that I think I neglected to mention when I was talking about the Answers for Care site is when you go there, if you don't know what you need, you don't know if it exists, you can always click contact us, and that will go directly to me, Nicole Christensen, and I will answer you directly. If we don't have it or you're not sure if it's even on there, we'll talk and I will try to find a great resource for you if it's not on Answers for Care, because I know it's overwhelming. And as much as we like to plan ahead, sometimes we're right stuck in it and we need help. And that's what Answers for Care is for. Again, we're a village of senior care solutions. So please connect with us. Join it. We're on all sorts of social media so you can find out what's happening. You'll find a lot of tools on our website, on our homepage, educational and otherwise, on video or blogs. We're really here for you to make sure you know before you have the circumstances to need it. But if you do come to need it, Answers for Care is where you can go to find a vetted, trusted senior care professional. So look for us next month. We'll be talking about more the navigation of care, as well as healthcare in general that can go to your home. So we'll help you through that resource as well. All right. Take care, everyone. Thanks so much.